Hi guys, I hope everyone is doing well. Can't believe we're already halfway done with clinical one. I hope you guys had a good second week. I would say this week was a little more challenging for me. I had a lot more one-on-one time with patients, and it was just kind of learning how to get into the swing of things and set up treatment plans and try to figure out what I want to put where in the treatment plan that would benefit the patient best. For example, we had one patient who was having some difficulties when she was working on her gait, and her main difficulty was trying to use her hip flexor to take a step. She tended to do more of a shuffle. So I was able to set up a treatment plan where we warmed her up on like a recumbent bike, and then we stretched her, and then we worked on her gait, and we noticed improvements when we did that. So just kind of learning the ins and outs of everything. I got to do a lot of gait training with different devices such as Hemi walkers, canes, and rolling walkers with platforms. And I've encountered something I never really thought about before. We have one patient who lost his vision in his right eye in a car accident, and so part of our gait training with him is we have to encourage him to turn his head so he is aware of what's happening on his right side since he no longer has vision in that eye, which was kind of interesting. It's not something I would ever thought that would need to do as part of the job, but just learning to adapt and kind of working with patients individually and finding what works best for them. I got to do some curb training for the first time, and it went well. It was a little different because the patient was bariatric, so it made things a little more complicated in trying to maneuver. But I was able to work with a rehab tech, and it was my first time utilizing a tech and just kind of learning that dynamic. So that was interesting as well. Got to do a couple of co-treats with OT, and it was kind of just trying to figure out how to work with them and how to make the treatment smooth and make sure we both got adequate time with the patient, which usually just ended up being she would do something, and at this clinic, OT focuses more on the upper body, we focus more on the low body. So for example, we would set up where OT would give the patient upper body exercise, and then I would give them a lower body exercise. We did have a lot of difficulties with patients this week who were just kind of more aggressive, not physically, but verbally, that were more yelling at us instead of being compliant. And it was something interesting to try to navigate and just kind of work with. You do feel for the patients. They are at this point in the hospital for at least a month or two, and I can only imagine what that's like, just being in the hospital in pain for all of this time. And I know it was probably frustrating, but then it becomes frustrating to me, excuse me, as someone who's trying to help them. So it's just kind of learning how to work with those patients, how to encourage them to do some sort of therapy with us without pushing it too much. We did have a patient who we were transferring from, we were doing a stand pivot transfer from the bed to the bedside commode. And this patient was new to me, very tall, big gentleman. And he is having knee problems. He has a broken toe on the other foot. He just kind of has sternal precautions. He has a whole lot that we had to keep in mind when doing the transfer. And he's also been diagnosed with some mental issues as well. And transferring him became very stressful, very difficult, because once he got on the bedside commode, he started having a panic attack. And he decided from there, he's like, I can't get up, before we even attempted to get him up again. So at that point, the patient wasn't going to help us, and it became a max times 3 transfer. So it's very stressful, but we transferred him fine. He didn't get hurt or anything, but just kind of dealing with some more difficult challenges this week. And then we had a new patient this week, and we were kind of going over the chart. I forgot to look at his labs. Thankfully, it wasn't just me that was chart reviewing for him. My CI did as well, and she mentioned like, oh, his hemoglobin's really, really low. And that's just kind of cued me to be like, oh, I need to remember to check the labs with a chart review as well as everything else. So just a lot of more in-depth things, a lot more challenges this week, but overall a good week. All right, well, see you guys.